Hello and welcome to the Community Voice. I'm Fara Sax. Dr. Julie Kantor, the newly installed 116th president, well, that's pretty old, of the Miami-Dade County Medical Association, is here today to talk about all things presidential, what she does at the association. Dr. Kantor, congratulations on this exciting new role.
Thank you so much, Farah, and thank you for having me here. I'm so excited to be here and talk a little bit about what I'm doing.
So let's talk about the vision for the association, the challenges, the opportunities facing physicians today, and the important work being done to advance healthcare in our community. So there's a lot to unpack, and I'm blessed to have you. We go back way back when our kids were little tots in the community.
Yes, we do. So first of all, as far as, being installed as the 116th president of the Miami-Dade County Medical Association, wow, so very exciting. And I think the word that comes to mind when I think about that is I'm so very humbled to be able to hold this position. And the organization has been in establishment since 1903. So when I say those words, 1903, that just holds so much weight as to what we've done as an organization. And more than that, as two females sitting here, as two women, I'm only the 8th female president in our time frame since 1903. So I think that's something also that needs to be mentioned. But beyond that, the excitement of becoming president, as I look forward, I think one of the biggest things that I'm most excited about is being of service to not only to Miami, but also to our group of physicians that we support. Whether you're looking at medical students who are just beginning their journey, residents who are still in training, young physicians, or maybe even doctors who are enjoying early retirement. I want them to feel that the Miami-Dade County Medical Association is their professional home. And I want them to turn to us as an area of knowledge, as an area of medical advocacy, as somewhere where they can come and they feel comfortable knowing that we represent all physicians of the Miami-Dade County area, and that this is not just an organization, but a professional home.
Very well said. And you have been in the profession as a pediatric emergency physician for over 2 decades.
Yes.
And your leadership through the medical education has also been inspiring other young people in their journey. Talk a little bit about how we came today to be together, wearing the same color shirt, mind you, I must say. But more importantly, what was that journey like for you as a pediatrician? Where did you grow up? Let our audience know a little bit about you coming in. I feel like we're doing a beauty pageant, but it's really important work that you're doing and for our community.
So I think the two things that are important to know about me is that my background is rooted in, as you said, in pediatrics. I've been a pediatrician at Nicholas Children's Hospital for 27 years, and I work in the emergency room there. And the other thing that's really important to know about me is that I've been an associate professor at Florida International University's Herbert Wertheim College of Medicine, so that's a mouthful, at the medical school there for 11 years, where I teach third-year medical students that are doing their pediatric rotation. And beyond that, before that, really, I went to the University of Miami for medical school, which is where I was really, truly taught what I think is the most important part is my foundation of medical skills and my medical knowledge, which I carry with me today as I treat patients, as I educate and train the future doctors of tomorrow. I went to Florida International University as an undergrad, Miami-Dade Community College. I was educated in the public schools here in Miami. So I'm a true Miamian, and being born and raised here in Miami and now practicing here in Miami, I feel that I truly represent all things Miami. And as a physician, have a really good perspective on what the doctors here in Miami-Dade County need as a leader of the Miami-Dade County Medical Association.
So you have served in mentorship roles all throughout your career, really, and now I mean, you have mentored and taught over 1,200 medical students, and through their innovative clinical training programs. How is this mentorship, and why is this mentorship such an important mission for you, not only for what you're doing currently as the president, but for these young people?
So mentorship is very near and dear to my heart. And yes, I have taught over 1,200 medical students and also residents. But I think if you talk to a physician somewhere along their career, they have had somebody who has stopped and taken an interest in them and served that really pivotal role as being a mentor. And we as physicians have that responsibility to pay it forward. And so when I look at mentorship and I look at the Miami-Dade County Medical Association, that's one of the things that I think is so important, is for us to become engaged in the doctors of tomorrow and showing them that that doctor-patient relationship, which really is at the core of everything that we do as physicians, it's at the core of our mission and our values for the association, that as a mentor, that we establish that with the young doctors that are coming up behind us. And it's our responsibility to do that and to pay that forward, as was done for us, to continue creating responsible physicians that actually are going to be our physicians. So we want that. We want that.
Talk to me. Who was that pivotal person for you in your development? If you could give a shout out to that person for that mentorship, is it one person? Is it a whole gaggle of people? Who is that moment when you went, I want to be a physician?
Well, so the story of wanting to be a physician is different than who were those people in my life. I knew at a very young age that I wanted to be a physician. And so from the age of 5, I knew that was something that I wanted to do, just an internal drive that I had. But there's many people along the way. I can think of teachers in elementary school. I can think of professors at Miami-Dade Community College. One of my most influential people in my medical career, Dr. Akram Tamer. He was one of the professors and physicians at the pediatric clerkship at University of Miami, who is just a wise owl when it came to pediatrics, and gave us so many little trinkets of information, showed the bedside kindness to families and to children that are going through difficult times. And in my residency, some of the attendings that are still practicing today at Nicholas Children's that were my mentors and my attendings that I now practice next to as colleagues, which is an incredible feeling to now call them by their first name when at some point they were Dr. So-and-so. So there have been many people that I've been fortunate to call mentors in my life at various times in my life. And
why the role? What is the role of the Miami-Dade Medical Association for our community? Let's talk a little bit about that, what they do and why it's important for a community.
So medicine does not operate in a silo. And when we look at our community, we have physicians that are in private practice. We have physicians that work in hospitals. When you look at what makes up our community, we have businesses, we have nonprofit organizations, we have people who work in government, we have people who work in education. Our community is just multifaceted, and their needs are multifaceted. And then we have the people that make up our community, our patients. And so when you put everybody together, the goal of the Miami-Dade County Medical Association is to facilitate and get everybody at the table, get those organizations together, get the members of our community together so that we can foster better public health, better patient access to care, better care overall, public health education. So when we can gather everybody in our community, which is a really hard thing to do, to get all of those people in the conversation, and the Miami-Dade County Medical Association really serves as a convener of all of those organizations and brings everybody together in an effort to offer better, more extensive public health service to the patients. And that's really where we're at, is connecting the community, the physicians, and the patients, and putting all of that together.
And coming in as the 116th president, I love it. I feel like your name is going to be on a coin one day.
Oh my gosh.
Along with Susan B. Anthony. So what is the opportunity for women in this field that you're seeing maybe that's overlooked?
So I think women in medicine, many, many years ago, my first class, so the class of 1999 at University of Miami, was the first class to have more women than men in it. So go class of 1999.
Kudos to you.
And actually, when you start to look at the makeup of medical school classes, there are more women than men in medical school today. I think men are choosing other careers, but opportunities for women are endless. We at the Miami-Dade County Medical Association have a special program. We have a monthly Women in Medicine conference, if you will, and we talk about various topics, and we encourage women, again, across all of our members, which include medical students, residents, women that are well into their practice, to come together. And again, that offers a collaboration, an exchange of information when we're talking, someone giving a presentation on perhaps a new test, a new treatment, that a medical student can listen to the presentation and hear an experienced physician question the presenter and hear things being offered. But we facilitate those types of opportunities for all of the physicians, not just the women, but for all of the physicians in our community. And actually, we have men that sign up for some of those conversations, and we don't only have it for women. We invite them to come along as well. But I think that women in medicine face certain challenges that maybe men in medicine don't. When we're trying to think about having a family in medicine, they face other challenges that when men in medicine have families, they're usually coming home to the children, while we in medicine, the women, I mean, when I say we, are actually actively doctoring and mothering. And so there's different challenges that we meet. And I think that the Miami-Dade County Medical Association addresses that by looking at women in medicine conferences. And there's something else, that I'm looking at as one of the pillars of what I would like to do as president, and that's looking at physician wellness. As you know, physician burnout it's a really big topic right now. And unless you know what physician wellness is, you can't begin to identify if you're a physician that's suffering from physician burnout. And so one of the things that I would like to do is encourage programming for physician wellness. And what do I mean by that? I'm talking about mental wellness. I'm talking about physical wellness, and even financial wellness. So some of those conferences talking about women in medicine. And so as you might say in your TV land, stay tuned. Programming to follow, Fara. So we have things coming up this year, and those are programs that we hope to announce for women in medicine and for addressing physician burnout, which for men and women, female physicians alike, men and female physicians, it's an epidemic really that needs to be addressed.
And we go to our physicians because we're putting our lives in their hands, to get better or to get well or to renew strength, whatever we go to our doctors for, to get, for a reason why we're not feeling so great or to keep well. But we forget that these doctors are people, and
Absolutely.
They too go through things in their own lives, whether their marriage, their own personal biologics, and we lose track of that. So talk to me a little bit about that. What happens to a doctor? What are the telltale signs that might not be feeling okay, that what burnout might look like? And because I think it's important that we know they're human.
We are human. And so I think that's what, patients forget. And I think one of the things that we are doing within the Miami-Dade County Medical Association, and again, a pillar, one of the pillars, I have 4 of them for my presidency that I'm really looking to address is medical advocacy, because physicians are really facing increased challenges right now. And these challenges have to deal with administrative burden within their offices, within their practices that have nothing to do with patient-doctor care. And this includes prior authorization, decreased reimbursement, physician shortages. So areas in Florida, areas in Miami that we call them physician deserts. That's a really scary word, a physician desert.
I've never heard of that. I've heard of food deserts.
Right. They're called medical deserts. And so you may or may not be aware, but medical malpractice is going up in the state of Florida. We are the 2nd highest state in the United States. And so physicians are leaving Miami or leaving Florida in droves because they simply can't afford to practice here. So through the medical advocacy of the Miami-Dade County Medical Association, we are trying to help protect the very valuable doctor-patient time and the doctor-patient relationship, which you hold and all patients hold very sacred, so that when I'm with my patients, I can be fully engaged and I cannot be burnt out. So the Miami-Dade County Medical Association is looking to try and reduce that administrative burden by doing advocacy, both here locally. We take it up to the F.A.A.P in Orlando. We go up to Tallahassee and talk to some of our state representatives to make sure that we can keep what's most important, that patient-physician bond, trust, and care that everybody needs and holds so dear.
And you mentioned also there were 4 pillars. We got to one of them. You want to talk a little bit about the other 3 that are important to you during your term?
So I think we covered 2. One of them was physician engagement, and that is that I want all physicians, regardless of where they are in their stage of physicianship, early learners, medical students, residents, I want them to feel that the Miami-Dade County Medical Association, that they have a place here it's not just an organization, that it's a home for them. So we talked about that. We talked about medical advocacy and how important that is so that doctors can really focus on their relationship. We talked about the 3rd one a little bit, which was physician wellness and establishing programs to help physicians identify what burnout is, but to keep us healthy as physicians, both mentally, physically, and even looking into financial wellness so that we know what that looks like for us, and that the Miami-Dade County Medical Association is really dedicated to helping physicians stay present for their patients. And last but not least, and we did touch on this also, is how important I think it is for our physicians to engage in investing in the doctors of the future, in mentorship, and that taking some of that time that we have, some of that very precious time, and somehow finding a piece of that to give forward and to find a medical student, a young resident that is in their early years, and find a way to inspire them, to listen to their concerns, to listen to their ideas. My best day is when a medical student or a resident brings an idea to me, maybe something that I didn't know, or an idea that makes me think, this is something, this is challenging. There's so much innovation going on. There's so much in technology, and there's so many new ideas that one person can't simply keep up with everything that's, new on the forefront. So when a medical student or a resident or someone brings something to me that starts a new conversation, that's the best day ever, right? Because I'm not teaching them, but it's a collaborative. And I think that's such an important word when we talk about the Miami-Dade County Medical Association, that it's a collaborative effort between us and our members, that we keep those lines of communication open, that we're continuing to bring them new information, reliable information that they can trust and they can turn to us when there's new things on the horizon and they're starting to develop whatever that new technology might be.
And it was what I find is really incredible. On just last month, June 13th, was your vesting, or you were vested, you were betrothed as the president. It's been a month journey.
Yes.
And talk a little bit about the gala, because I was there. I got to witness you being, it was just so cool. It was just really cool to see that, because you are a woman of valor, you are a woman of your heart, and it was just, this was the right person for the medical association to choose. And I was sitting with a table of young medical students, and they were so excited. And the leadership that you provide, they couldn't stop talking about you and why they were there. And so that really speaks volumes to you. And what was that like? Go back to that moment when you got on stage that night and you saw all familiar faces smiling back at you in support.
So it was really, truly one of the most memorable nights of my life. And I said, outside of getting married and giving birth to my 2 children, it really was a night that took me a long time to process, and still processing as I look at the recaps that are posted and the pictures and the sound bites. And it's a lot to take in, looking at the audience and seeing so many supportive faces, people that have meant so much to me, the Nicholas children, support that I had for being 27, my entire career I've been at Nicholas children.
And they stood up for you. They literally stood up. They were jumping up to support you. That's like an amazing affirmation.
It truly, truly is. And I'm so blessed to have been in one place for 27 years of my career, and my support from FIU, 11 years at an institution. I mean, not many people can say that they have that kind of a timeline, with an institution. And my students, and there were actually physicians in the audience who were my medical students and then went through residency and now have MD after their name and are actually practicing medicine right beside me.
What's that like? What is that like?
It's like raising a child and now seeing them out in the world successful on their own, which when you look back at what the Miami-Dade County Medical Association wants to do, to partner, to collaborate, I mean, it's just represents everything that we stand for. And living the dream in Miami, which was what the theme of my gala was, born and raised here in Miami, educated here in Miami, choosing to raise my family and have my career here in Miami. Miami is just an amazing city. It's a city like no other.
It's extraordinary. I mean, it's diverse, it's culture, it's resilience. It's all of it right here.
You stole my adjectives. I mean, it's multicultural, it's multi-ethnic, multilingual, and there's something here for everybody. And when I thought about what would be the best way to celebrate my community as I started my year as president, I thought having the theme of Miami and having everybody who came that night, and as you know, because you were there, the centerpieces, each centerpiece.
Oh my God, the
different.
centerpiece! I was like, Miami Vice. Now you're really dating me, but it was extraordinary. Every table had its own little stand up of everything.
There was Little Haiti, and there was Key Biscayne, and there was Coral Gables, and there was Vizcaya, and there was just Overtown, and so every corner of Miami was represented in an artistic way.
It was beautiful. It was beautiful.
Thank you.
Well, I should have taken one of those little centerpieces. I wouldn't fit into my little purse, so I just said.
No, it was definitely was not small, but I wanted it to represent just how different Miami is. And when you look at Miami's differences, that's when you realize the strength of Miami. And so all of our differences put together is what makes Miami who we are and celebrates who we are as this phenomenal city in which to raise a family, in which to become a physician, because you are practicing with just a phenomenal, phenomenal community around you to support you and from which to learn. it really does offer you just a wealth of opportunity.
Talking about the changes that are going on also in medicine, I mean, it's rapidly changing. We have AI, new technologies. What is that, the challenges for physicians right now with all of this future of the medicine? I wish I had a crystal ball. What's going to be? But how does the organization, the association, help in bridging those changes, going along as we go down the highway of medicine?
Absolutely. So healthcare, the future of healthcare it's so exciting. And like you said, just wait a minute and there's something new. Everything is changing. And I think one of the most important things to recognize is that whether it's technology, whether it's AI, whether it's a new surgical procedure, there's always something that we need to be considering. And we are talking about that throughout all of our daily lives. But the most important thing, Farah, that we have to remember is that whether it's technology, whether it's AI, there's nothing that can replace a physician walking into the room and the judgment that only a human can look at a patient, and you know this very well, that a human can look at someone and make a judgment about how sick you think a patient is, the empathy that a physician, a live physician, can give to a patient that's sitting across the table or next to them at a chair, and the trust that a live physician can give. So trusting and judgment and empathy while technology is zooming ahead. And we need technology. And AI is phenomenal as an assistant to be able to help with diagnoses and testing and things like that. But we cannot forget how important the actual physician is in all of that. And the second question you said is, what is the association doing? We are there as a trusted source to provide for our physicians continuing medical education, to look at what's there and provide that information for them so that they can have that information readily available, and to be there for them as a source together as an association, so that we're a trusted source for them.
Dr. Kantor, do you think way back when, 20 some odd years ago, more for you because, you had your schooling to go through, so it's like 30 years now. Is it different now versus then with all this, everything so sped up and AI and technologies? Is it different? And how do you teach these young interns, residents, tomorrow's physicians in keeping in touch with that? Here you are, here I am, that touch, that, like you were saying, that observation to diagnose and to make that judgment, as you said, for a patient.
So I think there's two answers to your question. Walking into a room and making a connection in pediatrics, with a family, with a frightened parent who's there with a sick child, making that connection today or 30 years ago when I was trained, that has not changed. It didn't change from 100 years ago. That is the core of what we do as a physician, is to establish trust, to sit down and listen to the patient's history. What is their concern? What's going on with them or their loved one? So that has not changed. Doing a complete physical exam, understanding how to do a traditional head-to-toe physical exam, that has not and will not change.
Good to know.
Those are the core principles that I was taught, and quite frankly, I refuse to give up. So when I'm teaching my medical students, that has not changed. Using your mind to come up with what might possibly be wrong with my patient, those are core diagnoses that you need to understand. Where does all of the wonderful technology and all of the stuff that's coming at us faster than we can even imagine, it is an accessory to our knowledge. It is an accessory to those skills of judgment, of empathy, and trust that are just absolutely core values that a physician has to have. So they are going to make everything that much better, but you cannot have a physician without what I was trained 30 years ago and 30 years before that, and hopefully 30 years in the future. You still need to have those core values as a physician.
Love that. I love that. In the time that we have left, final thoughts. Anything we might have missed during this interview that you want to interject?
Well, we covered so much. I think that my final thoughts are, if I were to look back a year from now and we were having sort of like a recap, so how was your year as president kind of thing, right? Like, how was your year?
That reflection.
Exactly. I would want to look back on a year where people look or I can say that I really did have the Miami-Dade County Medical Association as a place where all physicians felt comfortable, where we are a reliable source, where we are a convener for everybody in our community, because our community is made up of so many different working parts, and taking those parts and putting it together for better patient care, better access to care, better health education, and all of that while still maintaining the core, most important thing, which is the patient-physician relationship. And if we can do that while maintaining medical advocacy and getting some of the stress off of the physicians for these administrative burdens that interrupt and take time away from the most important thing, then I can look back on my year and say that, yes, I did some good things for the Miami-Dade County Medical Association.
And it was a very good year then.
I hope so.
Dr. Julie Kantor, thank you so much for all you do for our community and for joining me in this conversation. And may you be the happiest 8th female president that the association has had.
Thank you, Fara, and thank you so much for having me.
You're welcome. And for more information, feel free to reach out to miamimed.com. That's miamimed.com. And thank you so much for joining me. Until next time, take care of yourselves and each other. Have a great day.